Welcome to Colorado & Company. I'm Tanya Rush in for Denise Plant. She has the day off. It's always so nice to see you with us once again this morning. We begin with a common struggle we all face. It's the aging process. Despite a healthy diet and regular exercise, it's difficult to reach our personal body goals due to persistent unwanted areas of fat. That's where science steps in. Smart Lipo and Vaser Liposelection are technologies used in an office setting to perform body contouring. They are minimally invasive fat removal procedures which break up and then dissolve unwanted fatty tissue trapped beneath the skin, resulting in a tighter, more toned appearance. Dr. Oscar Aguirre is an internationally recognized board-certified gynecologist, fellowship-trained in urogynecology with over 10 years of experience in reconstructive and cosmetic vaginal surgery. He is an accomplished cosmetic surgeon providing minimally invasive in-office body contouring procedures, and he's joined by Letha Heitman, the patient coordinator. How are you?
Very good.
Welcome to the show.
Thanks for having us, Tanya.
Dr. Aguirre, let's learn a little bit about your background. This is fascinating, this whole topic, and why you chose this particular field.
Well, kind of chose me, I guess.
Really?
Since I was young, I was interested in infertility, which led to me pursuing an OB/GYN residency. And then I was exposed to reconstructive surgery, which led to my fellowship in urogynecology. And then with the urogynecologic patients who are coming in to see me for issues like incontinence and prolapse, they also have a lot of cosmetic and aesthetic concerns that I have a huge interest in.
Yeah, I can definitely tell. And talking before the show, it's something that's very much a part of your life. And you address a variety of medical and cosmetic needs that have resulted from pregnancy, childbirth, or even aging. And you offer, you like to say this, minimally invasive procedures to address those concerns. So it seems like a big topic, but elaborate that more for us so we understand better.
Sure. So it's very common for a patient to see me for medical issues like urinary incontinence. And oftentimes that may be a result of childbirth or just aging. And so there are now treatments that are very minimally invasive to treat those problems. And those patients also may have concerns regarding other changes that happen with the aging process or pregnancy or childbirth, such as vaginal relaxation or vaginal looseness. Or some cosmetic issues, whether it's unwanted areas of fat in their tummy or saddlebags, etc.
Those areas.
So, and so what's nice is with technology, we're able to treat those problems with very minimally invasive techniques, whether it's treating incontinence as an outpatient or treating the cosmetic issues, whether it's vaginal cosmetic concerns or body issues, also in the office under local anesthesia.
Really? That seems pretty amazing. And then it sounds like some of them you're there and then out that same day.
Right, yeah. So, so the liposuction is done with a patient fully awake, as are the cosmetic vaginal surgeries.
Now, what are the differences of the minimally invasive lipolysis and the traditional liposuction? Sure.
So with the technologies that are now available, such as Smart Lipo, which we have in the office, as well as Vaser, we're able to break down the fat, or what you mentioned earlier is lipolysis, with very small cannulas, and as opposed to bigger cannulas that were used before requiring general anesthesia. So these patients are fully awake. We do it under a special local anesthetic. They're actually talking to us during the procedure.
Really?
It takes on average an hour to 2 hours depending on the body part that we're doing. And then the second part of it is actually, you know, we suction out the fat again with small little cannulas and do the special contouring of the areas, whether it's the abdomen, legs, thighs, you know, almost every area.
Now I hear the word cannulas. You're saying, so, is that a type of, what is that?
So cannulas are small little tubes that we can suction out the broken down fat cells.
Which makes that easier. And Letha, you are Dr. Aguirre's patient coordinator. Yes. Sounds like you have a big role. Who is your typical patient?
That's a great question, Tanya. We've had women in our office as young as the age of 18 all the way up to age 70.
Really? Yes. Wow. And what can they expect when you call your office and they go in for that initial consultation, which I can imagine might seem a little scary?
It does, and as the coordinator, we really take pride in educating our patients. We bring them in for the consultation, sit down with them one-on-one, and conduct a needs assessment. Depending on the size of their body, what their skin texture is, it's very important that I explain to them the difference from the Vaser versus the Smart Lipo, which is laser, and the ultrasound and laser technology on how they break down the fat. It's very important that the patients have realistic expectations,
of course,
what to expect before, during, and after each procedure. So I secure that I ease that comfort with them at that appointment and give them the reassurance in making the correct decision.
Well, I can tell you're both great at that. You're both very comforting just sitting here, and you're on live TV, so we know that that's true. Where do you perform these procedures?
Yes, well, we do them in my office. We have a special procedure room for that is set up much like a small OR. And all under the local anesthesia.
Okay.
Yeah. So what's nice is we don't have to go to a hospital or a surgical center, since it's all done very minimally invasive.
That's great. Now let's see your work. I've been waiting to see this, and we have some before and after photos that we're going to take a look at, and kind of just walk us through what you've done here.
Sure. So these are before and after photos of a woman in her 40s, I believe, who is just 2 weeks out. So. She for years has been bothered by the saddlebag, especially on her right side. So on your left screen, on the before, this is an exaggerated or a larger saddlebag than there is on the left.
Look at that.
And then you see the post-op, and this is just at 2 weeks. So, and I see here also at 2 weeks that there's still some swelling there. And so the final results from that won't be, the best results will be noticed even to the 4th or 5th month.
Look at those differences. Look at this one.
So this is a young lady, she's in her 20s. So this is actually someone who has not had any children or pregnancies, but she just had unwanted fat kind of centrally in the abdomen and also some above the umbilicus there, or the belly button. And so that shows the kind of the side view. And this was taken actually at 4 weeks. And this lady actually had Vaser. The lady before had Smart Lipo. So I have both the Smart Lipo and the Vaser, and I select which technology I want to use depending on the areas I want to treat. And this is again that same lady had, so we did the upper and lower abdomen and also kind of the muffin top, if you will.
Oh, the muffin top.
So she's thrilled.
I bet. Your work is wonderful.
Oh, thank you.
The difference there. What is recovery time like? I mean, minimally invasive, but on average?
Yeah. So on average, consistently, if we do this on a Friday, they would easily go back to work on Monday. So there's very little downtime. The weekend would be very simple. There's some discomfort. They'll feel pressure. But nothing requiring hospitalization. Really? So for several weeks, we asked them to wear a garment, so sort of like a Spanx underneath their clothing. It's still comfortable. They can wear something loose over the garment, but they're able to go to work. We just asked for them to take it easy for several weeks. No heavy exercising.
Now, can people do something together? For example, with the Smart Lipo in conjunction?
Well, no, these are independent procedures.
Okay.
Now, I could use the Smart Lipo and the Vaser in one patient, depending on what we're treating. And the other advantage of these procedures is it also offers a skin tightening effect. So, in the whether it's an abdomen with loose skin, then I can use the Smart Lipo to tighten the skin more. We can also accomplish that with the Vaser, but it depends on the patient's characteristics. The other things that we can do is it's very common in my patient because my patient population is like Letha said, anywhere from 18 to their 70s.
Yeah.
And so we'll often do a sling procedure to treat incontinence or prolapse, and then the following week or within a week or so we do the liposuction in the office. So they have just one recovery that they go through to address many issues.
Great. Now before we close, we're out of time. This is very fascinating. I could keep speaking, but you love educating your patients.
Yes.
I can hear from what Letha said and everything, very important.
Yes. And every office visit is educational. The patients have many questions, whether it's incontinence or the liposuction options. And with that, I mean, that's the reason for us being on this show. Whether it's introducing patients to new technologies, but also we plan to be here in February and in March also to introduce.
Great.
Yeah, because we also offer, I want to go into more detail about some of the cosmetic gynecology procedures that we do, and also some of the newer fat transfer techniques that are available whether it's natural breast enhancement or fat transfer to the buttock that we'll be doing later this year.
Well, nice meeting the both of you, and I look forward to the next couple of months with you. Thank you.
Oh, thank you.
Yes, wonderful work. Aguirre Specialty Care is a center of excellence for women, providing everything from urogynecologic procedures to body sculpting to skin rejuvenation. We encourage you to attend Aguirre's Specialty Care Seminar, Resolution Possible, on Thursday, January 27th, 6 p.m. Dr. Aguirre will be discussing how to achieve a slimmer, more sculpted body, you heard, in just a day. There will be special seminar-only pricing available, and this presentation, this is the best part, is free and open to the public. Space is limited, so register by calling 303-223-6162. As a special offer to our Colorado and Company viewers, Aguirre Specialty Care is offering a complimentary body sculpting consultation. Each person who receives a consultation will receive a certificate for a complimentary ASC signature microdermabrasion. That is a $110 value there. Be sure to mention Colorado and Company when you book your appointment. Here's the number, 303-223-6162, or visit, here's the web, ascdenver.com. Aguirre Specialty Care paid for this segment. Very interesting. Up next, taking